relationship between drug and device industries.
What we believe is that education
your
needs to be
doctor
developed
making a profit out of your healthcare.
The House of Delegates just voted to endorse the individual mandate on care. The individual mandate
may be a bitter pill for some drug companies, but when doctors receive free lunches, it's their patients who often pay the price.
Some of the biggest issues that are facing the quality and credibility of CME really focus around the fact that there are many misperceptions around commercially supported continuing medical education.
In the past few years, the CME environment has undergone a lot of different transformations.
For the most part, companies who are grantor companies in CME are following the rules because they've gotten the message. Providers are following the rules, and things are getting better all the time in this area because people are essentially educated.
Many of these misperceptions come from examples that precede the ACCME's newer standards for commercial support and the new system of accreditation.
Managing conflict of interest, I think, is the most difficult effort that CME providers have these days, or most difficult challenge that CME providers have these days.
The focus on quality and credibility, and specifically financial conflicts of interest, have really heightened.
I think when we're looking at the definition of conflict of interest, many providers have looked towards disclosure. But disclosure is only the first step in the process.
There are a lot of issues around CME right now that are a part of the public dialogue. The most important one, or the most frequent one we hear, is about whether or not there's a conflict of interest with the grantor in CME.
Besides disclosure, we also should be looking at the level of the relationship of commercial interest that a faculty or someone who is involved in the development of the content or influencing the content may have with a commercial interest.
What we've seen is a change from a time 5-7 years ago where conflicts of interest were known but really not disclosed and not addressed, to a point now where not only do we have to disclose, but we have to manage those conflicts of interest to ensure that CME quality remains very high.
Part of the problem is that there are no industry standards that have been established for the resolution of conflict of interest. It's really been left up to each individual provider to come up with a system to resolve COI. Part of the problem there is the fact that there is no real definition for what is resolution of COI.
A monitoring program or system helps to validate whether or not we are executing within the system in an appropriate fashion, and that the end result, the education, is of the highest quality and integrity that it can be.
ACCME doesn't dictate how conflicts of interest can be resolved. However, they provided, when they first came out with the standards for commercial support, a mechanism, and the mechanism that they suggested was peer review.
As a provider in our setting, we have the responsibility to ensure that we have measures in place to protect the independence of the content and to our best of our ability, mitigate any of those financial relationships that do exist to ensure that the content ultimately is truly independent.
ACCME accredited providers are responsible for 3 things when it comes to conflicts of interest: identifying them, resolving them if they exist, and disclosing them to the learners.
Well, the resolution of COI, conflict of interest, is really pretty easy. If someone actually has a conflict on something that they're speaking about, they disclose it. And we make sure as much as possible, using peer review and other ways, that it's not a biased review or use or suggestion on those drugs.
Peer review of content is becoming even more important over time, not just to resolve conflicts of interest, but to ensure the validity of the content of continuing medical education.
One of the ways that we can address conflict of interest is by ensuring that the content meets a very high standard and demonstrates independence.
You try to have people who are experts in the field look at any program or any one speaker's presentation and look at that from peer review. Essentially, is this person focused on just one product that he has a conflict of interest in? Or is this person an expert in the field that understands all of the possible options and speaks about those in an unbiased or as possible, unbiased as possible way?
While ACCME lists peer review as one of the mechanisms to resolve conflict of interest, there's a difference between having the peer review take place internal to an organization or external to the organization.
There is a conflict of interest for someone in my own shop to go out and audit or monitor educational activities that we supported in the first place.
It's important because we need to make sure that all the content that we produce in a certified space is completely independent and without reproach and has no conflicts of interest and bias weaved within to the content. And one way to do that, to ensure that that doesn't happen, is from experienced external review.
You can try using an internal review system, but there are not necessarily no conflicts involved between your internal staff and your internal reviewers with the activity.
I also think that independent review has demonstrated its value because the most important thing that it's offered is raising the bar in terms of the quality of the content that's being developed, and again, ensuring the fact that that content is applicable to everyday practice and is really focused on improving patient outcomes.
ACCME has said that independent peer review by a non-conflicted expert in the field is in fact the best way to resolve conflict of interest.
These peers are people that have gone through a rigorous education. They've gone through the same education that the person creating the content has. Somebody who's really been vested and involved in the medical community, someone who really cares about the patient and understands the content that's being developed so that they can make those type of comments and decisions around it.
I would say that there are a number of criteria you could develop that would cause someone to be considered a peer. Among those would be in a similar profession or sub-profession or specialty.
It's very important in terms of CME content review to have the reviewers come from the same content area, physician specialty area, where the content has been developed.
It's critically important to have qualified and well-trained reviewers to give providers a feeling of comfort, to give them a level of comfort that they are being compliant.
One of the issues that seems to constantly come up in terms of bias in CME really focuses on the commercial influence, the commercial bias of CME. And one of the best ways to answer those criticisms and to demonstrate independence is to show that the content for an activity has not been developed solely by the faculty or authors, but that that content has then taken the next step, which is to have someone totally unconflicted with any kind of commercial influence or commercial relationship, has reviewed the content, is at the same level as the authors of your content, and understands the science and is able to validate that it is correct, that it is encompassing, and that it is unbiased and free from influence.
I think it's important for all CME providers to start to demonstrate the value of the educational activities that they have developed.
It needs to be based on learner needs, and it needs to be developed and implemented in a way that's going to help healthcare professionals improve the care that they provide their patients.
The most important thing, though, that we must know is that CME is the solution to some of our problems. And one of the most important of those is the delivery of efficient and effective health care to patients in America. And CME is one of the solutions. The problems around conflict of interest are real and important, and we must continue to focus on them to make sure that we do CME appropriately.